people system-wide, with a positive number of 65,501 for a total positivity rate of 15.3%. If we look at the hospitalization numbers now, they are up rather sharply from a week ago. At Baptist Memphis, there are 28 people currently in acute care non-ICU beds. There are 6 people in the intensive care unit at the moment with COVID, and 4 of those 6 people are on the ventilator. If we look at Baptist DeSoto, there are 9 people in acute care non-ICU rooms with COVID, 1 in the ICU with COVID, and that person is on the ventilator. So the numbers, it's interesting, from the time I left our get-together last Wednesday, it was fairly striking that very afternoon, we saw a rather sharp increase in people in the emergency department, admissions to the hospital. And I would say most notably, we have seen a significant increase in vaccinated admissions. There's a lot of debate right now about how effective the vaccine is at preventing the Delta variant, and that's its own sort of discussion. But I would say that I asked several of the infectious disease doctors here, and everybody sort of agreed that we have seen more vaccinated individuals admitted to the hospital with COVID in the last week and a half or so than we have seen cumulatively in the entire weeks before that. So certainly kind of a concerning trend. We're nowhere near the numbers that we saw in the past, up to 170, 175 in the hospital, but we have gone from about 10 to 34 in the space of a little over a week. So that's probably emblematic of what we've seen in other states near us, most particularly in Missouri, who's been hit harder than that even. We saw reports of some hospitals running out of ventilators there again. I don't think we're anywhere near and are unlikely to get to such a point again here as we saw before. But it is a sharp increase, and one that I think we have to at least take notice of and watch it carefully. So happy to answer any questions if there are any.
Hey, Dr. Threlkeld, it's Corinne. How are you doing?
I'm good, Corinne. How are you?
I am doing pretty good. I do have some questions from readers who wanted me to ask you a few things. So the first one came from a woman. She says she's 80 years old, fully vaccinated, but she's still been a little bit cautious about doing things like eating indoors. Given the Delta variant, she wants to know if the advice on, whether vaccinated people should be in those indoor environments has changed.
Yeah, and so, and obviously just being general about this, because you have seen varying recommendations, obviously, between the CDC and the WHO, as we mentioned last time. You've seen statements by Dr. Fauci that people in Mississippi should consider wearing masks indoors even when vaccinated. So with the caveat that any individual decision on that will be somewhat affected by the local rate of transmission, I can just tell you what I do, and I'm a fully vaccinated person and immune competent so far as I know. An 80-year-old would be expected to have a lower intense immune system than somebody in my age bracket, so they have to be a bit more careful in that regard. I think outdoor activities are largely still safe, but to the point of the question, should you be indoors without a mask, even if you're vaccinated? Somebody in their 80s or 90s has to be, I think, a bit extra careful, because there are those who've suggested, and I think that's reasonable, that if you're in your 80s and 90s, a vaccinated person is significantly protected, but they're probably not necessarily more protected than a 20-year-old without a vaccine, because they are so much safer in terms of serious disease. We are definitely seeing people, and we have had a death or two among older age group and even a middle-age person that had been fully vaccinated. So my own feeling about that is that you should be careful about being around unvaccinated people in crowded places where you can't reasonably distance, particularly if the airflow is not good. The ventilation is not adequate. That is shown again and again to be a really pivotal issue. So for me, because everybody in my family, stateside at least, is vaccinated, I think what I do is I wear a mask in an indoor situation if it is very crowded and the airflow is not great. And the more the more potentially disadvantaged my immune system is, the more I'm likely to do that as well. So someone in their 80s and 90s, I think, has to be more careful than a vaccinated person in their 30s and 40s. Because the statistics would bear that out. And where we really get into problems are the younger kids that have not been vaccinated. They are innately at less risk than somebody in their 80s and 90s, but they're unvaccinated, and how that compares is a difficult situation. There was I think it was a piece in Today maybe that looked at 4 different infectious disease physicians and what their thoughts were specifically about their unvaccinated children. It's a slightly different idea from the question, but it was interesting. One of the doctors, Dr. Hijano, was a St. Jude physician here in infectious disease. And it was interesting to see that their perspectives were not identical. There were subtle differences in whether or not they would take their kids to a movie theater or allow them to spend the night at another unvaccinated kid's household. And so not everybody had the same thoughts. But I think the general trend was very similar. And that is simply that the less protected you are, the more you have to pay attention to the items that minimize infection, like social distancing and mask wearing. And I think a person in their 80s in general would be in that group that I would pay a little more attention and be more careful to do those things that mitigate the risk of infection beyond the vaccine, because we certainly are seeing people who are vaccinated and are admitted to the hospital. So again, I think that's an intermediate sort of risk group, someone vaccinated in their 80s. The Delta variant clearly is much more infective or infectious. And so we are all more likely right now than we were a couple of weeks ago to encounter someone that could infect us. That is to say, that would be infected themselves. That's by and large going to be in the unvaccinated group. But make no mistake, once there are fewer and fewer unvaccinated people, the more people will be out there vaccinated, you'll just see more of those cases. And we certainly have seen more vaccinated people be infected and be in the hospital. And within that group, the older you are, the higher your risk would be.
The second reader question that I had for you was someone who's kind of confused about how we should be interpreting some of these kind of conflicting reports on how effective the vaccines are against the Delta variant. It seems like every day there's, it is very effective. The next day, we're not sure yet. So how should we be interpreting those conflicting reports? And are we getting to a point where maybe we need to do some precautionary masking again?
Yeah, well, tell your reader to join the club. It's difficult to interpret some of the data that are coming out at us. I think there's several ways to look at it. These studies, not a lot of them are not yet published and fully peer reviewed. So a lot of those differences will come out under further sort of scrutiny and discussion. But I think some of the vast differences in the outcomes of these studies, some have to do with the studies not really looking at apples and apples. For example, the Israeli study was the most striking in its pessimism of the effectiveness of the, I guess is the Pfizer vaccine that we're really talking about, because that was the lion's share of the vaccinations done in Israel. There are very high vaccination numbers there, as people know. They did an incredible job up front of vaccinating their citizens. But what they're seeing is the effectiveness of the vaccine has dipped into the 60s in terms of avoiding symptomatic disease. Importantly, all of the studies to date really still suggest that they're very good at preventing serious illness and death, into the high 80s and 90s, if you really look at those data. And that, after all, is the real measure of a vaccine. I mean, if a vaccine allows you to get asymptomatic infection or minimally severe infection, then that's still a victory for a vaccine. Though in this day and age, in this illness, we have to be careful because it still may allow you to give it to someone else. But if you look at the Israel study that was the most pessimistic about preventing disease in general, you have to realize how they screen people. In Israel, unlike what we do here and in a lot of other places, if somebody is around someone with COVID-19, they screen everyone around that person, symptomatic or not, and vaccinated or not. And so what they are likely to see is more cases that are asymptomatic, vaccinated people that wouldn't have been as clinically important as what we might see in the United States. So that could account for the reason that the Israeli study was the most pessimistic and showed the most cases after vaccinations. But again, I think the jury is definitely still out on exactly how protective it's going to be. For now, the data are still quite encouraging. it still seems in every study, including the Israeli study, to do a very good job of protecting us against severe illness and death. And again, that's really job one. But let me be clear, we absolutely are seeing more cases of vaccinated people hospitalized than what we saw before, and we're seeing younger people hospitalized than what we saw before. Both of those, I think, are real things. You have to realize that as the pool of vaccinated people grows, the likelihood of a given case being in a vaccinated person is going to be higher. And to put that a little different way, if you take the ultimate example, if you have vaccinated 100% of your population with a vaccine that's 90% and not 100% at preventing significant infections, you're still going to have 10% rate of significant infections, and they're all going to be in vaccinated people because that's all you have left if you vaccinated everybody. So vaccinations do not completely necessarily eliminate the infections altogether, particularly if there is a stream of people coming into your country or your city that would be a source of infection, maybe just a few unvaccinated people that come in. So as to the second part of that, does that mean we need to take a little bit more caution? I personally have. I mean, I'm a little more cautious now with these increased rate of infection with a more contagious virus and a continued high number of people around me that are unvaccinated. Healthcare workers have the added problem of being around people who aren't as protected. And we've mentioned that before. I think the onus is on us to be a little more careful on behalf of the people that we're taking care of and going to be around in a hospital setting. And I think by and large people do. But I certainly have changed my behavior back a little more towards some increase in mask wearing, particularly in indoor situations. But I think it's something, I mean, we saw, healthcare workers are now, it seems, going to be mandated to be vaccinated in France, for example. More hospitals are requiring that their employees be vaccinated. So it'll be an interesting give and take, both medically and unfortunately politically, on those sorts of questions. But yes, it has changed my behavior on masking and distancing, in that I'm a bit more careful than I was 2 or 3 weeks ago, because now the Delta variant is it's the majority of the infections in our country now, and very shortly it'll be essentially all of them. And as we're sequencing virus, we're seeing almost all right now hospitalized cases being of the Delta.
Dr. Threlkeld,
Yes, Jane.
There seems to be a lot in the news about children and vaccination rates. And if you think about when school starts here, I really am not seeing very much of a push locally to get children vaccinated. The schools are not requiring it. I wonder what you might say about that.
Yeah, and so you knew that, as I say, in our Groundhog Day scenario, we are unfortunately playing out. The schools are going to come up very shortly and be a hotly debated topic once again, just as we saw last year, just as we saw in the springtime when there was a push for in-person learning. Schools probably represent one of the most difficult topics on several levels. When you look at the debates that we've seen, and you mentioned we haven't seen a big push for kids to be vaccinated. And of course, the problem is that there's a substantial number of kids, obviously in elementary schools, who are not yet eligible for vaccination. So in those K through 12 schools, some of them out there, half of your population is going to be unvaccinated because they have to be. But the schools have been so difficult for several reasons. I mean, think of the topics that we have debated, again, both medically and politically related to the schools. At first, was the school going to be the super spreader environment? And that was really the concern for a lot of us, frankly. I mean, I was concerned that the schools would be a big chamber of viral transmission with kids located close to each other. Was that going to be safe? Then were teachers were not in the first group to be vaccinated. That became its own debate. Should we wait until after the teachers were more protected? Then data started to come in. And then we began to look at, the disadvantaged people economically were paying a bigger price for being out of school, for example. People with complex disabilities, those people suffer a bigger loss for being out of school. There's something short of 500 kids who have died in this country of COVID or its complications. It's not any kid is too many, but I realize the number is small compared to adults because they are more protected. But then we also have to realize that there's a cost in actual loss of life for not being in schools. I mean, there are actual deaths that have been linked to schools being closed, not to mention the psychological and learning problems that have accumulated over that year of people being out of school. So it certainly is one of the most complicated questions. Obviously, those of us who do what I do are very eager to get everyone vaccinated that we can. You throw on that the complicating situation that a lot of the studies have suggested much lower transmission in school situations. And of course, all of those studies were done when there was no vaccination of school-age kids. It started, I think, in North Carolina, spread to Wisconsin, where lots of kids were looked at over weeks and weeks and really found not to have transmission nearly as high as the community transmission during the weeks that the study was going on. So schools are not felt to be a significant risk for transmission, with the caveat that a lot of those studies were done in schools that were not necessarily overcrowded. So there were some mitigation strategies in place. So I think that what's going to be important for schools is going to be in the beginning of the school year with this Delta variant, if it stays the predominant variant, which we expect, and it continues into the fall months, which I think we also expect, it probably makes sense for schools to start a bit conservatively with social distancing and masking as they can, if they're not in an overcrowded situation. But you're exactly right. Pushing for vaccines in those kids is going to be very important. Now, without going into an entirely different line of discussion and question, why aren't kids getting vaccinated? Well, by and large, from my discussions with people, it's very simple. People are even more careful about their kids than they are about themselves, and they're concerned about the safety of the vaccine in the kids' age group. And I think by and large, it is easily and far more safe to get a kid vaccinated than to take the chance on COVID. And that is not to that goes beyond the actual COVID disease and few deaths in kids. It goes beyond even the MIS, multi-system inflammatory syndrome, that we see in other kids right after COVID. There are a lot of long COVID problems that we see in kids that we haven't even adequately measured yet. Some problems that we see in adults and kids. So I think that we have not yet really accurately counted the cost of kids being infected with COVID. So I think it still remains vastly safer to vaccinate a child than not to vaccinate a child. But parents are worried about things like, the myocarditis issue that happened predominantly in males, predominantly after a second shot, and predominantly in a fairly young age group. The complicating factor in that is that regular viral myocarditis with Coxsackie virus and other viruses that do that also happen predominantly in males and in younger age groups. So it can be difficult to settle those out, but suffice it to say that there did seem to be a something of an increase in kids that have been vaccinated. Again, we would still say nothing like the protection that you get from that vaccine. But I think it makes sense for parents who have reservations. We know the positives of all this. I mean, it's very clear that people are protected by the vaccine. They're very effective, even against the Delta variant, with all of these caveats that we've laid out there and increased problems that we've seen with a more contagious virus. It's still a very safe and very effective vaccine. So if you have those problems, I would just urge parents to talk to if they have a physician who has some experience with COVID. There are some physicians who do not, there's no question. But if you have access to a physician or trusted healthcare worker that has some perspective and knowledge about COVID, makes perfect sense to check with them about the individual case of your child. And certainly, yes, we hope that we can vaccinate all the children that we can prior to the school year. It's going to make a dramatic difference, not just in protecting the kids, but also in the community, because those kids are obviously going to be around people who are not as protected because they can't be as effectively immunized. People with immune system problems, cancer, chemotherapy, organ transplantations, other immunosuppressive medications, and just the elderly. And last I checked, grandparents have a hard time resisting hugging and being close to their grandchildren, even if they are unvaccinated and in school and more likely to have picked up COVID-19. So I think it's better for everybody to push those vaccines to try to get them out to everybody that we can.
Thanks, Dr. Threlkeld.
Thank you, Jane. Any other questions? I have a couple from the feed from last week that I will skim over as quickly as possible. Whitney Griffin pointed out that people who wore the mask still got sick. And I guess there are two ways to interpret that. Whether, if they are vaccinated and wearing a mask, there aren't too many people getting sick. There are more than there were before with this more contagious variant, but fairly protective. Those who are not vaccinated, the mask is far from perfect. We've always known that. So it's going to depend on how much exposure you have, exactly the particulars. And I would just use this to make the point that the same is true for the vaccine. Those people whom we have seen who have been really ill and a couple of deaths who have been vaccinated are typically people that, when you really look at the situation, probably were up close and personal with a super spreader type person. There was an outbreak around them. They were probably at ground zero of that outbreak. And so they probably got such a large inoculum of the virus that they were exposed to that it may have overcome some of their immunity and allowed them to get sick as well. So it's no question. I think everybody would agree that nothing is perfect. But if you stack up a couple of these protections with vaccination and the occasional strategic use of masks, even when vaccinated, I think it's very, very good protection and not to be taken for granted. Isaac Kike asked if you take corticosteroids, does it affect the vaccine efficiency? And the answer is unfortunately probably yes. We've even looked at those sort of strange studies that said if you take a Tylenol or an anti-fever agent right after the vaccine, within 4 hours, there could be some antibody differences. That does not necessarily translate into clinical changes. It just showed that in a pediatric population, the antibody levels were a little bit lower. We don't know how important that was. But corticosteroids are definitely immunosuppressive, so we like to avoid corticosteroids or any other immunosuppressive medication around any vaccination, including this one. That does not mean that if you have the opportunity to get the vaccine now and you happen to be on corticosteroids that can't be stopped, by all means, vaccinate anyway. We can, if we are in doubt, check your antibody level to the spike protein later and assess the response to that vaccine. It's not totally clear what to do with that information just yet, but there are ways that we can potentially get around that. So important to be vaccinated, even if you are on corticosteroids, but we do have to realize that could decrease the effectiveness of it. My favorite one was, man, answer the question, do we need to wear the mask, yes or no? I hope my previous comments have said that we don't have great data on that, and that frustrates people that we don't have black and white, easy to interpret numbers and studies about this. But I think everyone should agree by now that it's going to be in part situational. And again, if you're inside, potentially exposed to a large amount of virus by people that could be unvaccinated, that's where the mask and social distancing probably retain some of their importance that they've had from the beginning. And somebody who's not in that situation and vaccinated, probably very little danger in that regard. Another comment, similar, get the vaccine and throw masks away. Not necessarily the exact same thing. I certainly have sympathy for that standpoint of getting the vaccine part. Maybe keep the mask in your pocket like I do and wear it on occasions when you're in a situation like that. Here's one. People who have COVID have antibodies, no masks or vaccine needed, personal choice, with exclamation points. I get the point, but unfortunately, driving under the influence of alcohol is not a personal choice in the same way that potentially exposing people to COVID might not 100% be a personal choice either. So I think it's something we have to obviously continue to debate. Angela Gordon asked, can vaccinated people get it? Can they pass it even if it doesn't make them really sick? And the answer is we don't fully know what percentage of people who are minimally minimally sick after vaccinations. We think that the vaccine is very good at minimizing infections altogether and therefore protects other people right off the top. And even if you do get sick, it probably cuts the viral load rather dramatically in most people. So we expect that to be quite protective for people around you if you get one of those asymptomatic cases after the vaccine. The data on that are not just stellar, but from what we do know, it really makes a lot of sense that would be the case. And I think that is all I have from the feed. So, any other questions? Okay, thanks very much, guys. Have a good weekend.